Hello everybody. How do you face the pandemic COVID-19? Are you worried and afraid to face this pandemic? I think you don't have to worry to face this pandemic because now I will share with you some important information related to the COVID-19. But before I deliver my presentation, I would like to introduce myself. My complete name is Maria Awis. You can call me Awis or Ri. I'm a student at Indonesian Catholic University, St.PAULUS Ruteng, especially at the English study program. Okay, I will get started in my presentation. Because now we are facing the pandemic COVID-19, so that the first thing that we must understand is the definition about the coronavirus. What is coronavirus? Coronavirus is a large family of viruses that cause disease ranging from the common cold to more severe from illness such as Middle East Respiratory Syndrome and severe acute respiratory syndromes. The virus, originating from Wuhan, China, quickly spread to various parts of the world, including Indonesia. Therefore, we call it an outbreak. Outbreak is the occurrence of the disease in the community where the number of people infected is more than usual. In certain communities or in certain seasons, and a disease is said to be an epidemic if a certain group of people or region is affected quickly. But now we don't call the coronavirus is epidemic, but we call it an pandemic COVID-19. What is a pandemic? A pandemic is a widespread disease outbreak throughout the world, and we have to know that the reason for naming COVID-19, which is an acronym which consists of CO stands for corona, V for virus, and D for disease, while 19 is for 2019 because the outbreak was first identified on December 31, 2019. Okay, you have to know that the cause of coronavirus infection. Coronavirus infection is caused by the coronavirus itself. Most coronavirus spread like other viruses in general, such as splashes of saliva with the patient or swish and sneeze, touching the hands or face of an infected person, touching the eyes, nose, or mouth after handling item affected by a splash of saliva with coronavirus. In addition, to know the cause of the coronavirus, it is necessary to know about the symptoms that are often caused by coronavirus. The symptoms are physical signs of a disease. Because when treatment, doctors will begin with a medical interview. Here, the doctor will ask about symptoms or complaints experienced by patients. In addition, the doctor will also conduct a cycle examination and blood test or to help establish the diagnosis. Therefore, that point coronavirus disease. Coronavirus can cause a variety of symptoms in the sufferer. These symptoms depend on the type of coronavirus that attacks and how serious the infection is. Here are some of the symptoms of a mild coronavirus, such as a runny nose, headache, cough, sore throat, fever, feeling unwell. And the thing that needs to be emphasized, some coronaviruses can cause several symptoms. The infection can turn into bronchitis and pneumonia, which results in symptoms such as fever that may be quite high when the patient has pneumonia, cough with mucus, shortness of breath, chest pain, or tiredness when breathing and coughing. By knowing these symptoms, there are several ways that can be applied in preventing coronavirus infection. We know that until now, there has been no vaccine to prevent coronavirus infection. However, at least there are several ways you can do to reduce the risk of contracting this virus. The following efforts can be made, such as the first, wash your hands frequently with soap and water for 20 seconds until clean. And the next is avoid touching the face, nose, or mouth when hands are dirty or not washed. And avoid direct or close contact with people who are sick. Avoid touching wild animals or birds. Clean and sterilize the surface of objects that are often used. Cover the nose and mouth when sneezing or cough with tissue. Then sew the tissue and wash your hands thoroughly. Don't leave the house of illness. Wear a mask and seek treatment at health facility immediately when you experience symptoms of airway disease. In addition, you can also strengthen the immune system by taking vitamins and supplements as a form of prevention from this virus. In other words, the coronavirus has become a common problem throughout the world. Therefore, proper handling is needed to overcome the spread of this virus. There are several methods applied in dealing with the COVID-19 pandemic. The first thing that must be applied is a restriction. A restriction is a limitation for a way to control someone or something. For example, at present, there are many travel restrictions throughout the world. That means there are restrictions or controls where you cannot travel. Some companies also limit their employees. They may cancel their travel plans or ask employees to stay at home to work. The second is social distance. The goal is to reduce close contact between people and to slow down the movement or spread of the coronavirus. This is why governments take action so that all jobs that involving many people, such as schools, companies, and etc., close down. If all schools or companies are closed, it means that we have to work from home, use the internet, email, and telephone. Social distance also means choosing to stay home more often and avoid public space or crowds. When you are outside the home, for example, if you are going to work or go to grocery store and see your neighbor, distancing yourself means you are not touching or making close contact. Instead, you keep your distance, and that means a big change in the behavior of many of us. Depending on where you live, it may be common to shake hands, hug, or kiss your cheek when you see them. But now it's better to keep distance again to slow the spread or transmission of the virus. The third thing that needs to be applied in accompanying coronavirus is to self-quarantine. The word quarantines means separate and limit the movement of people who have the coronavirus or who are exposed to the virus and those who don't. If you quarantine yourself, it means that you need to prepare food supplies at home. Food supplies means having additional supplies, especially basic needs such as food, medicine, and other important household. And this is very appropriate if you are going to quarantine yourself for 14 days. You need to prepare canned foods that do not too easily, and frozen food. Dry or non-absorbent items are long-lasting foods. But one thing to avoid stockpiling. Hoarding means having extra large supplies that you hide and keep to yourself. If you stock keep inventory, that means you take more than you need, and as a result, other people don't have the opportunity to also save and prepare. And that is something we want to avoid. Of course, right now we want to protect ourselves and all the people we love. This is also a time to protect everyone in our community and help where we can. The fourth thing that needs to be applied in relation to handling coronavirus is to apply isolation. Isolation is the most limiting separation. Isolation is separating people who have infection disease from healthy people. The purpose of implementing restriction, social distance, quarantine, and isolation is to slow down the transfer of the coronavirus from one person to another. And there are three important reasons why we do this. The first one is to protect you and everyone you love. Number two, protect those who are the most vulnerable. So far with the spread of the coronavirus, it seems that the elderly individuals or those who are elderly and individuals with compromised immune system are most at risk. Your immune system is your body ability to fight virus or protect itself from virus. Compromised immune system means a weaker immune system. As a result, the person may get sick more easily or his body cannot fight the virus, and also someone with a healthy immune system. A third important reason for slowing the spread of the coronavirus is to reduce the possibility of overstressing, overdoing, or burdening our healthcare system and hospital. Okay, that's all, and thank you for your attention to watching my video, and I hope you can apply what I have shared with you, and keep healthy and stay at home, guys. See you.